Hello everyone, I am Dr. Priyanka Rawat and here I will be teaching you Salpingitis. So Salpingitis stands for the infection of fallopian tubes. Okay, so infection is usually polymicrobial in nature. What does it mean? It means when there is more than one microbe present and it leads to Salpingitis. Okay, so both tubes are usually affected, and if their ovary is also infected, so we called it as salpingo-uveitis. As we all know, infection of ovaries are called as uveitis. So when both the conditions occur at the same time, it termed as salpingo-uveitis. So next we are going to discuss etiology, and in etiology means how the infections occurs in fallopian tubes. So what are the causes of salpingitis? So there's ascending infections from uterus, cervix, vagina. As we all know that if the infection from vagina, cervix and uterus ascends towards the fallopian tubes, it can lead to salpingitis. Okay, and these are the microbes which can cause salpingitis. Okay, so this page has been added by mistakenly, so just leave it. And then the infections which can lead to sexually transmitted infection also can lead to salpingitis. Okay, so these three microbes can lead to salpingitis. Okay, and mycobacterium tuberculosis also can lead to salpingitis. And after that, the microbes, there also direct spread which can lead to salpingitis. Suppose if the patient is suffering from appendicitis, diverticulitis and pelvic peritonitis, these conditions can lead to salpingitis. Okay, and these are also microorganisms which can lead to salpingitis. So after that, the salpingitis is of two types: acute salpingitis and chronic salpingitis. As you all know the terms acute and chronic. So in acute salpingitis, there are two types: acute pyogenic and acute gonococcal. So we discuss both of the terms here. Okay, so acute pyogenic salpingitis, what does it mean? Pyogenic, as you all know the meaning of pyogenic, it means there will be some kind of pus, and pus will be formed. Okay, so start with the so suppose the patient is suffering from acute pyogenic salpingitis. What will happen? The intense hyperemia with the dilated vessels. Hyperemia means there will be the blood in the vessel which can lead to dilation of the vessel. Okay, so with dilated vessel, as vessel is dilated, we can see from our cannot see from eye, sorry, it's visible under peritoneal cavity. Okay, so tube enlargement occur due to involvement of interstitial walls. So the wall of the fallopian tube become thickened and edematous. Okay, so after that, suppose if microscopically we see the infection, so the epithelium and muscularis layer also affected and both are edematous, and these you can underline this outer coat involved on adhesions likely to be occur there. Okay, so the infection, suppose infection is very severe and pus formed there, and femoral end opens. Okay, so what will happen? The pus from the fallopian tube escapes out and causes pelvic peritonitis. Okay, after that, acute gonococcal, as just remember the overview that acute salpingitis is of two types: pyogenic and gonococcal. Second, we are discussing acute gonococcal. So in gonococcal, what will happen? Hyperemia happen as we discussed in pyogenic. So tube swollen, edematous, same. Adhesions are less present in pyogenic. Adhesions mostly formed, and purulent. The exudate from the tube escapes and it come in the peritoneal cavity. So after that, complications, the acute salpingitis leads to generalized peritonitis, pelvic abscess, cellulitis, tubo-ovarian abscess, pelvic thrombophlebitis. Okay, so after that, diagnostic criteria. What will be the diagnostic criteria? These four will be the diagnostic criteria. This is not necessary that all tenderness are present in one patient. It depends upon person to person. And after that, there will be some kind of temperature increase in more than 38 degrees Celsius, and leukocytosis will be present. Okay, complications and diagnostic criteria. So as we have discussed acute salpingitis, we come to chronic salpingitis. So in chronic salpingitis, we are going to discuss pathology, hydrosalpinx, biosalpinx, chronic interstitial salpingitis, and salpingitis ischemica nodosa. Okay, so first we start with hydrosalpinx. So hydrosalpinx, what do you mean by hydrosalpinx? Hydro is the generally we use these terms for water, but there is some mucus type of condition will be present in fallopian tube. So collection of mucus secretion in fallopian tube is called hydrosalpinx. Okay, so pathogenesis, that how this process occurs in salpingitis. Okay, so these four microbes, Staphylococcus E. coli, gonococcus, and Chlamydia trachomatis leads to endosalpingitis, and if this attack is repeated in nature, it leads to hydrosalpinx. Infection, what will happen? Fimbriae gets edematous and the serous surface adhere together. Okay, so here I will be depicting you. So this is fallopian tube and fimbriae get edematous. Okay, and abdominal ostium, suppose what will happen? Serous surface adhere together, and which can lead to closure of abdominal ostium. Okay, suppose uterine ostium also closed, so it can lead to congestion in between. Okay, so secretion is pent up. Suppose secretion is pent up here, and distension marked by ampullary region, and distension causes tube to curl. Okay, so what will happen then? So the fallopian tubes looks retort shaped, wall is smooth shiny, containing clear fluid inside, uterine ostium not closed anatomically, as you all know. So intermittent discharge of fluid into uterine cavity called intermittent hydrosalpinx. Okay, so these are the investigations and complications. Torsion and ruptures occur, and formation of tubo-ovarian cyst. So after hydrosalpinx, we are discussing in chronic salpingitis. First we have discussed hydrosalpinx, and next to discuss pyosalpinx. So pyosalpinx is pyogenic organisms becomes very virulent, produces intense inflammatory reaction and secretion of pus. So pyogenic organisms leads to secretion of pus and inflammatory reactions. So tube becomes closed at both the ends. Okay, both the ends. Tubes becomes closed, and abdominal ostium by adhesions, and uterine end by exudates. Okay, exudate and adhesions are the two causes of closure of fallopian tube due to intense inflammatory reaction inside, escape of pus into peritoneal cavity. Okay, and it can lead to tubo-ovarian mass. Okay, so tubo-ovarian mass will be formed. After hydrosalpinx, pyosalpinx, third is chronic interstitial salpingitis. Interstitial salpingitis. So in chronic interstitial salpingitis, tube enlarges due to great thickness of wall, and abdominal ostium may closed or may not closed. So the adjacent organs adherent to the tube, and if we see microscopically, there will be the extensive infiltration of plasma cells and histiocytes in all the layers of fallopian tube. So it leads to intense fibrosis and hinders the tube motility, and which favor ectopic pregnancy. Okay, so after that, fourth one is the salpingitis ischemica nodosa. So if chronic interstitial salpingitis and tubercular infection present, and there will be one or two nodules present in the tube, it is called salpingitis ischemica nodosa. So later treatment. So I have divided this into two parts: outpatient therapy and inpatient therapy. In outpatient therapy, we can give levofloxacin 500 mg and metronidazole. Okay, or in outpatient therapy, if patient is having more than 39 degrees Celsius temperature and look is very toxic, rebound tenderness is there, so we go for these medicines. Okay, so thank you so much. I hope you understand this topic.